Okay, we're live here at Fort Belvoir. I'm going to give it 30 seconds for people to log on. Can I just get a sound check while we're waiting the 15 seconds? You got good sound?
70. Yes, sir.
Okay. We're just going to wait as everyone logs on to the live feed. Just give us a couple more seconds so everybody can get on. All right, we're going to get started. So I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Thanks for listening in on this town hall. As Captain Cindy Judy, next to me, the director at the Fort Belvoir Community Hospital, and I update you on our situation, address questions and concerns that you may have on COVID-19. I also want to update you on the efforts to protect the health of our team, our service members, civilians, retirees, and family members at Fort Belvoir. We're in uncharted territories and working rapidly in this changing environment. We continue to do these virtual town halls weekly just to make sure you're updated on the current day-to-day operations and what we're doing to ensure safety across the installation. We encourage all personnel to follow the guidelines issued by the Centers of Disease Control and Prevention and the policies issued by this garrison. I have asked our Public Affairs Office to continue to work with our mission partners and our community across the board to provide the latest updates on our Facebook sites and our World Wide Web. I want to ensure we continue to provide clear, consistent, persistent, fact-based communications, leveraging both the social medias, our newspaper, and then our virtual town halls. First, I want to thank everyone who works and lives on Fort Belvoir, for your patience and understanding as we continue to operate under Health Protection Condition Charlie. I mentioned that we did increase to Charlie last week. The closed caption video of the town hall is updated to our Facebook page. Go to the video tabs where you can find all of the virtual town halls. So where are we right now? All the information that I'm going to recap can be found on a website. So I issued out a curfew last week. That curfew of unaccompanied minors 17 and under is still in effect from 8 p.m. to 6 in the morning. We ask our parents and our guardians for their continued support in ensuring that their children adhere to the curfew for safety and well-being of our Belvoir community. I also ask that everyone enforces what we're putting out for social distancing, so not just curfew, but as you see something, say something. I think it came up last week at the town hall where there was a bunch of children playing on a playground. Again, if it's not within the guidelines, please say something to the parent or to the children. As far as gates, the Tully, Lieber, and Farrar gates will remain closed, and the only gates that are open for access right now is Lieber Gate and Pence Gate. I ask that you honor the gates are in no salute zone until further notice. There's been some issues that have come up to me in the last couple of days of service members who want the guards to salute them as they come in. Please understand we're very traditional here, but at this point, I ask for your patience and understanding as we make this a no salute zone. The guards, both service members and our civilian guards, are under a lot of pressure right now. They are wearing personal protective equipment. We are not looking, they cannot see sometimes the ranks on the IDs. And so again, I ask for your consideration for the no salute zone. Essential services such as the exchange and commissary, regardless of HPCon level, remain open, especially the commissary. I encourage each of you to check the websites and social media sites for updated hours for any of our concessionaires on the installation. The commissary. So I would ask, so the commissary is open. And if you haven't been there, we've been doing a lot of monitoring and also trying to prevent too many people from being in the commissary. I would ask that you try to limit the number of family members that you bring to the commissary and try to avoid going during busy times such as the mornings. Instead, try different times of the day or have one individual from the family go to the commissary and have other family members virtually shop online, virtually shop as you walk through. The playgrounds and outdoor gathering areas such as picnic areas, skate parks, outdoor archery and dog parks are all closed. Many of our mission partners have already taken measures to reduce their employee footprints by using telework and other alternative work schedules. Many of our Garrison staffs are also working alternative work locations and work schedules, and we are doing agencies are doing enhanced screenings at their work areas. I want to just take a minute to talk about a case that happened last night and dispel any rumors and be transparent. So over the next few minutes, my goal is just to give you the rationale behind last night's decision to close our CDC. What you'll see as I tell you this is there was a deliberate decision triggered by an unfortunate event, and that we took swift actions to make sure that we protected our employees, our children, and the community. So yesterday I received a call from the Child Youth Services informing me that we had a positive test of COVID in the CDC with one of the workers. And so, what I want to say is, we closed it. We got the results yesterday. Let me back up. The individual felt sick last Friday, so she had symptoms. They had symptoms. The symptoms drove them to get a test on Saturday. The employee was self isolated or quarantined, and now is in isolation because the results have come back. The employee did not go to work this week. The minute we got the results yesterday, we worked with the hospital, and the hospital worked with the county to make sure the trace was done immediately. We did an unofficial trace to get everything we needed to know yesterday to get the notices and information out to those who potentially could be affected by the positive case. And so last night, again, out of abundance of care, I decided it was in the best interest of our children and the caregivers to close the CDC until 13 April. Do all the trace and do all the self quarantines, and making sure before we open back up on the 13th of April that we are very well postured for that event. I appreciate the hospital and the county working hard to get the traces done and to do everything we need to do to put that information out to the community. I also want to let you know, additionally on this, I think 2 weeks ago there was concerns that our CDCs were not safe, or there are other actions that we need to take at a Garrison. That week we did have a public health assessment going that week. We did a full report on our child development centers, and we have done periodic public health assessments on the CDCs to include this week. And so those precautionary measures are being done in conjunction with our hospital. What I also directed yesterday was a public health assessment across the installation at all AAFES concessionaires. Actually, it was done on Monday. And the hospital and our nurses went in, did the assessments across the installation, such as our shopettes, our food establishments doing grab and go, and our common areas that are highly trafficked. They did do the assessments. They provided me feedback. All areas did pass those assessments. And I thank the commissary and AAFES for their continued support and measures to protect the community, and I thank the hospital as well. I also want to just generally talk about details of COVID positive individuals and disclosing information or not disclosing information. And so I just want to put it out there. You have a right to know if you or your children have been exposed from COVID. I have an obligation to inform you of that in the most effective and timely manner, and likewise the hospital has those same things. So this is exactly what we do. At the same time, we're obligated and legally bound to safeguard an individual's personal identification information and personal health information. This is why we do not disclose those details in open forums, and we protect those individuals' rights. So I thank you for your continued patience and adherence to these health and safety protocols. I want to just dispel a couple more things out there, and then I know we have a bunch of questions. We'll go through some of those questions. Thanks for those inputs on those polls. So many of you may have read some restrictive measures that have been adopted at other installations. I want to let you know we remain in our current posture, and we will announce any changes to our posture or additional measures if it becomes available to elevate to the HPCon posture. Okay, although our HPCon status has not changed, I would ask that if you do not have to be on Belvoir, I encourage you to forego visits unless it's for essential items such as food, medicine, medical appointments, or mission essential work. But let me be clear that whether we are in HPCon Charlie or if something trigger us to elevate to HPCon Delta, that we will not close this installation. Last week I published a policy instructing residents to self-quarantine, to basically report if they are self-quarantined, isolated, or conditionally released. And that applies to all residents at the villages of Belvoir, those living in the barracks, and those individuals temporarily occupying our IHG lodging facilities. Again, that directive is applied for those folks in those categories. I ask you to continue to self-report to my operations center. That is for government use only. That information will not be disclosed on any open forums. In fact, we do not even ask for names for that self-report. That information is really for our first responders, for those who have to go in if there's an emergency, and we do not share addresses, specific addresses with our maintenance teams. That's why they are also asking those 5 questions. But what we do is we provide the maintenance team with a street, and if any of the work orders are on that street, they call our operations center and make sure that their employees are protected, and we will verify that that house is or is not a self-quarantined house. So again, I wanted to share with you what that data is being used for. Okay, one of the other recurring questions is from both the Garrison and the hospital is the details of the number of Fort Belvoir employees or residents testing positive for COVID-19. I understand that many of our Fort Belvoir community have questions and concerns, and we are doing all we can to address those quickly as while we maintain confidentiality and operational security as necessary. The Garrison will not release numbers of positive tests, nor will the hospital. We will take all appropriate public health measures to care for our infected and identify, inform, and quarantine those who may have been in contact with infected individuals. We will continually communicate with the community to ensure you're aware of public health conditions on the installation in our local area and make you aware of guidance from local authorities and military leaders. However, we will not provide to you an aggregate number of total positive tests on the installation. And then finally, before we go to some questions and answers, I want to end on a sad note, as I must share that on Tuesday, Defense Logistics Agency employee who worked on Fort Belvoir did pass away. The individual had tested positive for COVID-19 and had been under medical treatment at the hospital, at a local hospital. Prior to the employee's positive test, the employee had been isolated from the workforce for more than 14 days while teleworking. My condolences go out to the employee's family and DLA co-workers, and I ask that you keep them in your prayers. I asked Captain Judy if she had any opening remarks. I think she forgave those opening remarks, and I think we're going to go to the questions and answers. And so I appreciate all the feedback that you have given us. We had our Facebook open poll, and so we're going to start. We are still taking questions on the line, but we're going to start with the open poll questions, go through those. Hopefully we answer those, and then take any additional questions as they come in. And we're going to try to rotate between Captain Judy and myself the best we can to give each other a break. So I think the biggest question that I had is is there a possibility going to HPCon Delta, and what would be the restrictive measures? Okay, and I'm going to change the question a little bit because I'm not going to box myself into a corner. So is it possible to go to HPCon Delta? Yes, it is possible. Okay, I'm not saying it's likely. I'm not saying it's going to happen. It is possible. It is based off of the conditions on the ground. The decision maker is the Military District of Washington Commander Major General Jones. Until he declares an elevated level, we will remain at HPCon Charlie. So again, I want to dispel rumors. We are not elevating HPCon levels at this point. Only the conditions on the ground would then trigger a decision to the senior commander to make that decision. And the other question was, what restrictions will be? And I want to reverse the question. I'm going to tell you what HPCon Delta is not. Okay, so I alluded to it up front, but HPCon Delta is not closing down Fort Belvoir. So again, I want to make that clear. HPCon Delta is not stopping, all essential work orders and contractors coming on to do their work that they need to do on this installation. HPCon Delta is not closing the grab-and-goes and the gas stations and AFES and the commissary. Those will not close. What potentially could happen is we could limit the access control points. So instead of having 3 access control points, we could potentially go down to 2 access control points. But again, to be clear, it's not closing down the installation. It's reducing down from 3 gates to 2 gates. And then also, we could potentially enhance screening at the gates, which means asking questions, potentially taking temperature readings. And so I think those were the major ones. That was what we would or would not do for HPCon Delta. And so I'm going to turn it over to Captain Judy.
Hey, thanks, Colonel Greenberg. Good evening, everyone. I'm just going to start off with the first question that I got was really regarding the guidelines and procedures to follow in case a person wants to get tested for COVID-19 at Fort Belvoir Community Hospital. And so I know many of you are aware, but I just want to share with you that we've implemented drive-up screening and testing. That happened about 2 weeks ago, and it's located by the emergency room entrance in the back. Patients who present at the drive-up are asked a series of questions regarding their medical history, their symptoms, their travel, or their COVID exposure history, and if they meet criteria, they can safely be tested outside. Then we'll go ahead and we'll collect that sample while they're outside. However, those that require further medical evaluation or treatment can be assessed inside, and so we can do that either in the COVID clinic or the emergency department or one of our clinics based on what their clinical presentation is. Meaning, I'm happy to do that testing outside, but I also don't want to jeopardize anybody's health care by doing that outside. So if they require further treatment and evaluation, we want them to come into the hospital. They'll park right there in the emergency department parking area, and we'll take them into where they can be evaluated further.
Okay, great, thank you. So the next question is the commissary Click and Go available? How fast does it fill? And then I'm going to add another question I think is down the page is why is the commissary not stocked throughout the day? And so, yes, commissary Click to Go is available. And how fast does it fill up? So I will tell you within hours, it fills up. And so the way the Click and Go works is there's normally about 50 to 57 orders that are processed daily. And the commissary has just increased. They are pushing the maximum capacity on how many they can process. So they're processing about 77 online orders a day. The ordering process is a 6-day process. So the next 6 days are filled up. It resets every day. So tomorrow morning, the 6th day from that morning is the day that is filling up. And so they take the first, 77 orders in that day, and once that fills up, then they're done for that day, and it resets for the next day. So again, I recommend optimize that option. That is a great way not to have to shop in the commissary. Apologize that the commissary can't do more, but again, they are maxed out on that service. The other question is, why is the commissary not stocked throughout the day? I would argue with you that the commissary is stocked throughout the day. What you're seeing potentially is those items that the commissary are having challenges with the distributor to fill on the shelves. I'm going to apologize for the commissary in the sense that we are having stockers fill the commissary shelves during the day and night. The commissary is working day and night to make sure that those shelves are stocked with the stockage that comes in. Those items that are hard to fill items are being rationing off. Again, I will take the responsibility. Those rationing numbers are coming from me. If you have a problem, please do not try to argue with the cashiers or the commissary management. Please come to me or come to my staff, and I will address those. Those rationing numbers are to allow for people to come in the mornings, afternoons, and evenings and have those items on the shelf so they can shop as well. Some of the items that are high value items or items that are having challenges to keep on the shelves are the pasta sauces, some of the canned meat like the tunas, some of the ramen products, soup, and some of the canned vegetables. But if you notice, the meats are coming pretty good, and most of the other items on the shelves are stocked regularly every day. And so again, I don't think that they're running out of items in the morning. So if you come in the mid-afternoon or evening, you're going to get relatively the same items as the morning gets within reason. So again, I think I answered both those questions. I'll turn it over to Captain Judy.
I know you touched a little bit on the reporting of numbers throughout the DoD and our limitations to doing that. And so while I can't speak specifically to the Department of Defense, I did want to address, somebody had a question about how severe is the infected rate here at Fort Belvoir. And I really do want to share as much as possible with the community on this topic, even though we can't report those DoD numbers. So Fort Belvoir is in Fairfax County. We all know that. And you can go onto their website and you can see what their numbers are for Fairfax County. We took a look at the age distribution of those cases, and then we compared our rates with those. And so what we're seeing is very similar to what they're seeing in their numbers. With the largest percentage of cases being among the 18 to 49-year-old population and the 50 to 64-year-old population right now. That's likely due to the volume of folks being tested within those age ranges as well. The majority of our beneficiary population lives in Virginia, Maryland, or DC, and we work closely with all of the county and state public health departments for reporting and completion of contact investigations. And so while we can't speak to those numbers, those are great resources for people if they're concerned. You look at what's going on in New York City right now and you want to know how Fort Belvoir is doing in comparison to that. Those are really great resources for people to go and find that information and see what's going on. All of our numbers are included in their numbers, and we're not seeing a higher rate here at Fort Belvoir in comparison to what the local community is seeing.
Great. Okay, so I think I've already addressed the changes in gates and access points, and the bottom line on that one is there is no change at this point. We still have 3 gates, and then we also have our commercial and visitor gate included in Lieber Gate. And again, the only thing that would change, Fort Belvoir will not close. We could potentially go down to 2 gates opposed to 3, and we could potentially have enhanced screening at the gates. And then the other question is, are there changes to the exchange hours? Any plans to close the exchange or limit access go non-active duty and their families? And so I will say there are changes that are coming from the concessionaires. Okay, so I would ask you to continue to keep yourself updated on our Facebook and our worldwide web pages. We do keep those updated. I appreciate AAFES continue the communication with us, and as AAFES provides us updates, we provide that to the community at large. If you are a beneficiary and you have access to the commissary or the PX or AAFES, you will remain to have access to those facilities regardless of what HPCON level we are at. And so again, make that clear. HPCON Delta does not limit beneficiaries' access to AAFES or the commissary. All right, you have a question?
I do. So where are infected soldiers and civilians being held? So folks are not being held, right? But military members and civilians in the Fort Belvoir community are placed in quarantine or isolation, typically in their homes, according to CDC and state health department guidelines. We've worked closely with installation to secure some temporary lodging when someone's living arrangement isn't optimal for safe quarantine or isolation. Those examples might be too many roommates, or maybe there's somebody in the household that's got some sort of medical condition that would put them at risk. And so we work closely with the base to protect those folks. The other place that we have folks in isolation would be in the hospital. So if somebody requires admission, then we will admit them to Fort Belvoir Community Hospital, either on our ward or in our ICU, depending on what their clinical presentation is, or they'll get transferred to a local civilian facility or up to Walter Reed National Military Medical Center, depending on what that acuity is.
All right. The next question was, are there any updates to the Child Development Center closures, refunds, and workforce changes? So I've already addressed the one CDC. We did close it effective last night. It will reopen on 13 April. Location to be determined at this point. I would ask for refunds and workforce changes, please. For refunds, work directly with CYS. I think I've seen a couple postings on Facebook that information is out there. Again, if there are refund questions, work directly with the directors, but you will get refunded for anything that is not used. And then for workforce changes, those are going throughout. Please work with your leadership on those workforce changes.
All right. If a child tests positive for COVID-19, will a parent be able to stay with them if they're hospitalized? At this time, our visitation policy will allow for a parent to stay with their hospitalized child. Of course, we're going to work with families on a case-by-case basis to ensure that the safety of both that child and that parent. So if there's some reason that the parent, maybe they're ill, shouldn't be in that room, we'll allow another family member or somebody to be with them. We want to make sure that our patients are all protected.
All right, the next question, are there any updates to ID card renewal? Can ID cards be extended beyond 90 days or beyond 90 days be renewed? And it got cut off. I'm not sure what the last part of that was. But are there any updates to ID card renewals? At this point, the Army is not extending ID card renewals. And it's not because of certificates or credentialing. The Army and DOD is working right now with TRICARE because the issue is if you do not extend your military IDs and your benefits expire, there will be issues when you try to get those benefits on the outside with TRICARE. And so that's one of the main reasons why we are where we are right now. Can ID cards be beyond 90 days be renewed? At this point, no. If there is an emergency, please work with our ID card section. But again, we have to prioritize whose ID cards get renewed at what time. And I ask that you have patience and consideration across the installation as we go through this process. And I think the last question may be about visitors' passes. So I will reassess here in several days. I think I extended 30 days. Again, my intent is to eliminate as much as I can with trying to conjugate people in one area. So I will relook at extending potentially passes for a longer time.
All right. What precautions, if any, is the hospital taking to maintain medication supply, not only for COVID, but for routine need, and do we have hydroxychloroquine? So the pharmacy currently has sufficient supply of most of our medications as well as the COVID-related medications. Where we anticipate shortages, we limit dispensing to 30-day supplies until that delayed shipment arrives, right? We can project that out. An example of that might be, I know inhalers right now, certain inhalers are on critical back order, and so we'll give one inhaler at a time as opposed to multiple inhalers so that we can ensure that everyone who needs one gets one, okay? We also work closely with the National Capital Region to cross-level or share our resources. It's one of the great benefits of being part of this region here with so many military treatment facilities in the area.
Okay. So the next question is, if installation access is closed, does this apply to River and Woodlawn also? So the installation access will not be closed. So for River and Woodlawn, you would still have access onto the installation. The next question, will construction contractors come from other states be able to use the exchange food facilities in Express? And the answer is yet for the exchange food facilities, yes. If they're an authorized user at the Express, then yes as well. Turn it over to you.
All right. So we got a question, why are the screening procedures so lax, such as basic questions, not temperature checks? It doesn't seem to be very secure in people's minds. I just want to emphasize that we are a hospital and our patients deserve patient-centered, compassionate care, right? The screening's being done in accordance with CDC guidelines. We may add temperature checks in the future, but we're currently not doing them. Our emphasis remains on clinically indicated measures. Despite what some may perceive, the access control points really have limited a bunch of people from coming in the hospital. Our goal really is to protect our patients and our staff without generating a lot of anxiety and fear. We recognize that a lot of people are afraid as they come to the hospital these days, and we want to make sure that those access points aren't deterring them from coming in. So compassionate care is important.
Okay, I'm going to defer. So this is a good dialogue or reference to our frequently asked questions. So any questions that I can't answer at this point or I do not have a decision made on, we will place that in our frequently asked questions and get back to you within 48 hours. So 2 questions I'm not willing to answer at this point. Will access to outdoor facilities such as water, lunch, ramp, fishing, and outdoor areas be available for families to stay active? And can the golf course trails be used for exercise, walking, and running? For these type of decisions, I get my advice straight from the hospital. I have a public health emergency officer who provides me guidelines on that. And so, although I think my FMWR director has an answer, I'm going to hold off and publish that at a later date.
So I got a question. How many ICU beds are at Fort Belvoir, and what's the capacity to expand that if needed? So we're a community hospital. We have 10 ICU beds normally, but we're part of the National Capital Region, like I mentioned earlier, which includes Walter Reed National Military Medical Center and numerous other military treatment facilities. The National Capital Region has an extensive expansion plan to support the pandemic with additional inpatient ward and critical care capabilities. We're also working closely with our local civilian network facilities. So if you've seen pictures, even at Walter Reed, they've set up tent hospitals, right? There's been a couple of things that have gone on in our nation. For the Navy, the Mercy and the Comfort have deployed to New York and to, I believe it's Los Angeles, to do some non-COVID care. Some of those similar activities are being planned for the National Capital Region in the event that the capacity or the demand exceeds the capacity, and we will continue to reassess that, but that is a very robust expansion plan that they have so that they can care for our beneficiary population here in the National Capital Region.
All right, great. Mr. Landgraf, you want to come up and answer this one, just so I don't get the technicalities wrong. So the question is, do the office cleaning crews take any additional precautions when cleaning? Are they required to do deep cleaning of workspaces, and how frequently?
So yes, sir. The office cleaning crews are taking additional measures. They are putting gloves on and cleaning with gloves more so than they had in the past. They are wearing masks if they feel that they need to, but not always. They often change gloves between different portions of a building, and they are cleaning with EPA-approved products. They are not taking any additional measures to deep clean. We are working on a contract to get more of a deep cleaning process in. That is beyond the normal cleaning contract that we have in place.
All right, great. Thank you. You have one?
So I just was looking at this other list that was given to me. Are there any changes to the Fort Belvoir Community Hospital visitation policy? I know Dr. Rapetta last week spent a lot of time talking about that visitation policy. It has not changed since then, and so that policy is available on our Facebook page and on our website. This is what I'll say. Even though there have been no changes, when a patient has a concern about the visitation policy, for example, if somebody's admitted to the hospital and they have questions, please ask those questions of their healthcare team that's involved directly in their patient care. There are some opportunities at times to make exceptions based on a case-by-case basis, and so the policy hasn't changed, but we do address certain care needs on a case-by-case basis.
Okay, great. So 2, I'm going to put into the frequently asked questions. Do service members with approved ETS PCSing from overseas have priority for on-post lodging to self-quarantine their families? And I think if the question is, is there a room on the on-post lodging for a family ETSing or PCSing? I would tell you yes, there are rooms available. So I'll get a little bit more details out to you. But again, if people need a place to stay, we do have Staybridge and Holiday Inn on the installation that are available for use. And then the other one is, what needs to be done for a family to move from on-post housing to off-post housing within 2 weeks? I would just ask you, that sounds like an individual question. So I asked if the individual could just reach out to either my housing team, my XO, or to the Michaels team and get an answer direct. If you cannot get an answer, then I will get you an answer, but that answer should be available for you. Okay, any others?
I'm running out of questions, sir. There was somebody who said something about calling the nurse advice line, and they directed them to the hospital, and they weren't sure what number to call, and they got directed to the front desk. The number to the COVID clinic is 571-231-0532.
All right, great. Okay, is there questions on the line? And again, we're using technology-wise. I have folks in a different room screening through the questions, and is going to provide me, I think, on the phone some questions.
Could you repeat the number one more time so people have a chance to write it down?
571-231-0532.
Okay, before I take another question, I have one more note. So just for folks are asking about legal assistance because the SJA's office is closed down. So anyone seeking legal assistance may call Legal Assistance Office at 703-805-2856. Again, the number is 703-805-2856. They can set up an appointment. Appointments will be conducted telephonically, and the SJA has procedures in place to accommodate most legal matters. If you're calling after hours, potentially clients can leave their voicemail, and someone will call you back the next business day. All right. Do we have other questions? Okay.
I'll just read it. Okay. All right. So, are you giving numbers to the CDC?
Speak up, please.
Are you giving numbers
Yep.
to the CDC?
I think that's to you.
Yes.
So the question was, is the hospital giving numbers to the CDC?
As in the numbers of reported cases?
Yes.
Is that what, so we report through the Departments of Health, and that all rolls up into the CDC numbers. That's how that works.
Mm-hmm. And another one for the hospital. Does the Fort Belvoir Hospital have ventilation?
We absolutely have ventilators, yes.
And another question that we have. Is the HIPAA violation for self-isolating houses to be identified with something in the front yard for awareness?
So I think the question is, if we identify someone in the front yard with a sign, is that a HIPAA violation? So I will get back to you because I'll have to advise with my SJA. And I don't know if the question's saying, can the Garrison direct someone to put a sign up?
So actually it was self-identifying. so they were doing it themselves.
But if somebody, I mean, that's no different, I think, that if somebody were to tell someone that they had a diagnosis, that's not a HIPAA violation when the patient or the family themselves shares the news of their condition with other people, so.
Okay, so I think what we got was, if you're gonna do it on your own and volunteer that information, it's not a HIPAA violation. However, if you're asking me to direct folks to do it, I will get back to you, but I am gonna take a wild guess that it is a HIPAA violation for me to force someone to self-regulate on their porch or in their area that they have been self-reported or quarantine isolation.
All right, and we have another one for the commissary. Okay. So why is the commissary still allowing over 100 people to shop at a time, and why is social distancing not happening?
Okay, so I would ask, so the question is, why are we letting in, and I doubt someone counted 100 people, but okay, a large number of people, and why is social distancing not happening? I will tell you, I have leaders going in there and trying to enforce the standards. I ask you, as the listeners here, to also say something if the standard's not being met, okay? And so, you know, we are limiting access. We are doing the best we can to limit the number of people in the commissary. Also understand we have several thousand people that use the commissary every day. If you didn't notice, on those high volumed aisles, we have actually put tape out on the floor that identifies the 6 feet spacing between folks. And so we've done a lot for you. If you look at the aisles, the checkout aisles, to go into the checkout lines, the commissary has added in between each back and forth, there's a display that actually allows a 6 foot distance between folks that are passing through, and there's marks on the ground. Again, I cannot have a guard force that is going in there and every minute of the day enforcing social distancing. What I need is for us citizens to say something, our beneficiaries. If you see something that's unsafe or you see people that are conjugating, please say something. I will re-entertain that with the commissary management as well. But I also ask you to protect our workers. So please do not go up to a commissary worker and get into their face or into their personal area of less than 6 feet and ask them a question. Okay, please, if you have a question for a stocker or for the folks that are putting meat on the shelves or frozen goods or anything else, please honor their space. If you have a question, you do not need to go in front of them. Keep your distances and ask the questions. Again, good question out there. But again, I will continue to try to have the commissary and our leadership enforce those standards. But I also will ask you to enforce those standards from your end as well.
Sir, we have, I believe, one last question.
Okay.
Okay. So what is the reason specific buildings have been sanitized, but personnel are not notified if an infected person was indeed working in the building?
Okay, repeat the question one more time.
So what is the reason specific buildings have been sanitized, but personnel are not notified if an infected person was actually working in the building?
So I'll talk about the sanitizing, and I'm going to let someone else talk about the notification. And the notification should be in the CDC guidelines. And so, so if there is a tested case that's on the installation in one of our office buildings, we have set up a individual contract for emergency cleaning for a positive COVID case. Again, meeting all CDC guidelines for those cleanings. And so if there is a self-reported incident, that incident should be roped off in the identified areas. The cleaning crew, the emergency cleaning crew will come in and will actually do that cleaning. I don't know if you could talk about...
Yeah, and so for the contact investigation, there's not a specific notify everyone in the building kind of scenario, but instead that contact investigation talks with the person who's been placed on quarantine or isolation to find out where they might have been in that building or who they've come in contact with. And so it would not be a blanket, everybody that works in building X needs to be notified, but rather the people that were actually directly maybe involved with that individual.
Okay, and great. And so I want to just follow up with just how things are working at the Garrison and the hospital. So like I said before, I have a public health emergency officer, and Captain Judy and I are obviously linked as well, and talk daily. And so anything that happens on the installation that happens with COVID, we do direct coordinations. We ensure that our folks are either, whether it's a custodial or a public works, are in direct coordination with the hospital to make sure that we're following all guidelines out there, whether it's notifying folks, it's tracing folks, it's isolating areas, all the procedural stuff that we're doing to protect the community. That is all in unison with the hospital. And so again, I want to make that clear as we go forward. Okay, is there any other questions out there at this point? Okay, so if there are unanswered questions, please get with Public Affairs. We will use that frequently asked page to post any of the unanswered questions. We are going to periodically do this every Thursday, so we will stay tuned on next Thursday. However, I say that, but if there is any type of conditional changes or anything that would deem us to need another virtual town hall, we will do that at that time, and we'll provide 24-hour notice. So with that, I'm going to turn it over to Captain Judy for any closing remarks.
Hey, I just want to say thanks. This is an incredible community to be a part of, and there's been great outpouring, both towards the hospital staff who are caring for patients and doing all of that screening, as well as for the patients in the hospital. And I'm just incredibly proud to be part of this Fort Belvoir community. So thanks for what you're doing for our staff and for our patients as we're all in this together.
Okay, and I just want to follow up, and I think we're pretty close on our time. But first, thank you. Thank you for listening to us. Thank you for providing us feedback. And thank you for allowing us to really communicate out to the force. We've reemphasized several points there. Hopefully we were very clear in our communications. If there are miscommunications or inaccurate information, that is not a good thing. And so again, I want to make sure that people understand, if you do not have accurate information that's been verified, please do not post that on any social media. Again, we only want to get out the most accurate information. Second, I want to thank everyone who supports Fort Belvoir, who's coming to work every day, that's making sure that our facilities and our installations is still running. So like I said last week, that second priority, first priority is really protect our community, but we also have to have mission assurance. And so we have a whole host of mission partners that are still operating day to day. And so those folks have to come in, and also the installation needs to support. And so those who are coming in, thank you. Everyone teleworking, thank you. But also for and I don't want to leave anyone out, but for all the folks such as our first responders, the hospital, firefighters, police, commissary, PX, all the others, the CDC workers, construction workers, custodial contractors, everyone, and again, I've left out 100 people. But for all those that are coming each day, the maintenance folks at the housing, but all those folks that are coming each day and endangering their lives by not staying at home, but coming in to risk something to provide a service for someone else. Thank you for doing that. We couldn't continue on without that support. So again, thank you on that one. Again, I want to make sure that everyone understands my number one priority during this health emergency is really to protect our force, the health, safety, and welfare of our service members, our families, our contractors, our government civilians, and anyone else who's using the installation. So we will continue to keep you updated on everything we're doing to beat this virus. Again, I ask you to do all the measures that have been prescribed by the CDC. I ask you to enforce the social distancing, the 6 feet, all the precautionary measures that have been put out to date. Again, I ask you, if you see something that's wrong, please say something or enforce something. Again, thank you for participating in the virtual town hall. A closed caption video will be posted on Facebook Also, continue to use our Facebook page and our websites as a resource for our latest information. Again, please be safe. Thank you for listening in, and we look forward to the next update.